Hi, today we will talk about enteral route of medication. It involves delivering medication directly into gastrointestinal tract. This method of administration is safest, common, convenient, and economical method of drug administration. The drug may be swallows, allowing oral delivery, or it may be placed under tongue sublingually, and in buccal cavity facilitation direct absorption into the bloodstream. The drug may be given directly into stomach and small intestine using NG tune and PEG tube. First enteral route is oral route of administration, which involves swallowing medication for absorption, primarily in small intestine. The orally drugs are easily self-administered and toxicity, and overdose can be overcome by antidotes such as activated charcoal. If we take about the advantages of oral route, it is the safest, convenient, and economical method of administration. Despite advantages, there are also some drawbacks. The stomach acid sometimes causes the degeneration of some drugs. Sometimes food interrupt and decrease the absorption of drug. In case of children and aged people, they find difficulty in swallowing tablet. This may be due to tablet size or taste of tablet. When drug get absorbs in intestines, it passes the hepatic portal vein and enters the liver. There it is metabolized before reaching the systemic circulation. The other route is sublingual route. In this route, the drug is placed under the tongue. This placement of drug allows a drug to diffuse into capillary network and then enter the systemic circulation. In buccal route involves placing drug between cheeks and gums. Sublingual route also grabs advantages. It bypasses the first pass metabolism, so no drug is metabolized and drug quantity remains as same as administered. The drug does not face the destruction by stomach acid. The stability of drug is maintained because the sleever is neutral. As drug reached directly in systemic circulation, so it may cause immediate pharmacological effect. The disadvantages are that this route is only limited to some drugs and to those drugs that can be taken in small quantity. The next route of administration is rectal route. In this route, the drug is inserted in rectum for localized and systemic effect. Typically, the drug is administered as suppositories, enemas, and solutions. The rectal route of drug administration has several important advantages as well as some limitations. It is particularly useful for patients who are experiencing nausea, vomiting, or difficulty swallowing, as it allows medication to be given without using the oral route. One major benefit is that a significant portion of the drug can bypass liver metabolism, first-pass effect, which may enhance its effectiveness. Additionally, this method helps reduce gastric irritation and can be used for local treatment of rectal conditions. In many cases, the onset of drug action is also relatively quick. However, there are notable disadvantages. Drug absorption through the rectum can be inconsistent and may vary from one patient to another. Many patients find this route uncomfortable, embarrassing, or culturally unacceptable, which can reduce compliance. The rectum also contains limited fluid, making it difficult for solid dosage forms like suppositories to dissolve properly. Furthermore, defecation can interrupt or prevent proper absorption of the drug. There is also a risk of irritation to rectal tissues, and this route should be avoided in certain conditions such as diarrhea or specific anorectal diseases.